Okay, we are a week out from having this lady's rhinoplasty, and what we did here, she was a little bothered by the bridge, the tip, and the sides. And so what you really want to do is create a balanced result. You didn't have much discomfort this last week, wasn't bad. So I built the bridge up, and this was done with diced cadaveric rib. The reason why I use cadaveric is that oftentimes, first of all, you don't want to scar. Second of all, they pick the best rib segment that's possible out there. Usually it's mid 40 years old. It's the highest quality rib segment. I dice it into really, really fine particles. Actually, I don't even do that. I have an assistant that does that, spends an hour doing that in preparation for the procedure. The reason I like that is that there's almost no chance of warping. There's great longevity. It doesn't go away. And if you compare this against the other methods out there, I used to use Goretex for about 10 years. Goretex was really nice. The problem with Goretex is that you lose about 1 millimeter of projection after about 2 years. You also start getting a little bit of pinching on the sides, and it can also have a little bit of deviation of the bridge. This avoids all those issues. Plus, the nice thing is not to have a solid implant. A full rib piece in there just looks too harsh. I don't like the look of it. And silicone implants are the absolute worst thing in the universe. A silicone implant, especially either a 1 or 2 piece implant into the nose, causes a lot of problems with extrusion, where it pokes through the tip, infection, warping, nasal tip contraction, things that are very hard to fix. If you look at the social media post recently that I think Denny, my social media director, just put up today or yesterday, that was a 4-time revision nose I did for this lady who had silicone, had all these different problems on her bridge and her tip that I fixed. And that was the 4th surgery she did to correct it. The tip, essentially, you're not going to see all the refinement right here. It's going to take probably a few months to really get all this in, but within another 2 to 4 weeks, you'll see an improvement. What I did here is I did what's called a lateral turn-in flap. So essentially, our nose has a convexity shape like this. And you want to get rid of that convexity. So what I do, in the old days, I would actually just cut out part of the cartilage. But the cartilage for an Asian is so weak that when you do that, you lose a lot of structural support to the nose. The other problem with that is that the convexity actually worsens, because if the cartilage here is weaker, it's going to bow more out because it's collapsing more inward. What's very interesting with this lateral turn-in flap is when you score the cartilage, you flip it on itself, and actually now the cartilage becomes rigidly straight. It's very, very interesting how flat and straight that is. So it halves the size, and it knocks out that convexity. You don't see the convexity here. Convexity meaning the bowing or the roundness that you want to improve, so you're getting more refinement on it. And also, again, you're not going to see it here. And then from the tip, what I did was called a caudal septal extension graft. She may be still a little tender to touch. I'm going to gently touch it. It's a very solid tip. That means when she's 65 years old, the tip should not fall. Very predictable tip results. When I used to do what's called a collie-meller strut placed in here, that after a week or 2, I saw the tip just shift down a little bit. After 3 months, it changed a little bit. I hated the unpredictability. I get incredibly predictable results. I can actually, and I also built up the collie-meller. This is the first thing she notices, that this base here has been, it's protruded in Asians. You actually lose this area. So I brought that forward a little bit, gave her some rotation. So the caudal septal extension graft, besides tip predictability and long-term durability, also gives what's called lateral tensioning. So essentially what that is that since the strut is anchored to the base of the septum, I can now have a firm anchor point on which I can project the tip forward. So when the tip is projected forward, what's really cool about that is that as I pull the tip forward, okay, with no chance of it buckling and turning up this way, is that this outer wing that's already been flattened by the lateral turn-in flap, by pulling the center pull out and tensioning it on a firm caudal septal extension graft, this naturally further flattens. So you get this incredible flattening effect of the side of the nose, a much better shape to the tip, although again, right now at a week, you're not seeing much. And that's going to look even better as that comes down. The final thing I did was a nasal-sill reduction. So I love the nasal-sill reduction because you can see even at a week, you barely can see the scars. I maintain and preserve the sill. It's like a windowsill. So it still looks like a very natural shape. If you look at a lot of the ones that, like, I hate to say, the poster child of bad rhinoplasty, like Michael Jackson, God rest his soul, and even his whole Jackson family, they've amputated the sill so that the natural curvature of the sill is now missing. I cut the sill, reduce the sill, but the natural curvature of the sill is still preserved, and the incision is hidden inside the nose for the most part. It's still slightly external. The benefit of this, it actually physically reduces the size of the nostril and reduces a little bit of the flare of the nostril, creates balance. I always do that as my last step because I want to see where everything is without the scar, the telltale signs of scar. So probably in less than 5% of the times, I will make the external alar cut. The reason I want to avoid this is not to avoid the cut-off appearance, because even when I do this, I never have that amputated look that it is a telltale sign that someone's had a rhinoplasty. I want to avoid this because of the long nature of the recovery where that scar is visible for a long time. And in my opinion, it's still somewhat visible even at a year. So if I can avoid the scar, still reduce the nostril size, create balance from the tip to the bridge, then that's the trick. Now, one final thought, you've heard this in my virtual consultations, is an overall concept. If you raise the bridge too high, not only does it look fake, but it swallows the tip. The tip and the bridge have to be balanced. If you project the tip too far out versus the bridge, is going to look off as well. And so this is the thing that a lot of my patients come in for consultation. They said they want to make the sides really small. The problem with that is if you're an Asian listening to this, or even an ethnic individual, and you pinch your sides in, you'll see that the center becomes too bulbous. So it's really important to go to an artist, and not just technical precision of the surgery, but really the bridge, the tip, and the sides must be in balance. I actually had a consult last Friday with exactly a week ago of a lady that said, hey, I can get like $600 less expensive than you, which I don't even know why she was arguing about that. But she was then saying, oh, because the implant is they're using this incredibly expensive implant made of silicone. I told her, look, silicone is so outdated. It is the worst thing as a solid implant to put in the nose. I did a podcast subsequent to that consultation so that I sent it to her because I wanted her to understand that that's really a problem. So it's not the cost of the implant. I mean, I have the best, the implant itself is not the issue. Having the design and the technical skills to execute on a well-crafted nose that should have great longevity and safety are the key elements.